was a PT tech in the Army for a couple of years, and I've been a PT for almost 49 years. What made me want to choose this profession? I think that it was a combination of my college major and minor, which was health and physical education and chemistry. And I learned even close to my senior year in college, in undergraduate school, of physical therapy and what it was. I'd never really heard of it. And when I read it, I went to the local hospital and asked if I could go to the PT department. And this gentleman had me spend the afternoon with him. And after that, I was sold and had fallen in love with the profession already.
What do you think are the most important changes you've seen in the PT field in the last decade or two?
The first thing that comes to my mind is that when I began practicing in 1975, we used a lot of what we call modalities, which is essentially machines. In those 49 or so years, we have drastically reduced our use of modalities and have turned almost exclusively to therapeutic exercise, manual therapy, and more functional activities. Another change that I have gladly been a part of is that physicians are finally showing respect for our profession. When I began, I was almost treated as a technician. I received the doctor's order, and whatever that order said, I followed. No questions asked. We have come a long, long way since the mid-70s, and we've reached a point where I think that physicians are seeing us as true professionals and ask for our advice about how to help treat their patients.
What have you enjoyed watching evolve in physical therapy education?
I think that when I began teaching, we were teaching the treatment diagnoses. That changed, and we began to look at impairments that patient demonstrated when we examined them, and we started treating impairments. And finally, this has changed, and it's due to what's called the ICF model, and that is a model of treatment of disease that includes the whole person, where we don't just treat the patient's impairments. We treat the person's need to participate in activities and to perform daily needs.
What do you consider timeless about the physical therapy profession?
I think two things come to mind. First is our observation skills. I have long felt as a teacher that the most important skill a student can bring to the clinic and that a physical therapist can bring to clinical practice is their ability to observe. And I think secondly, I would say passion. From the very beginning of my career, not only have I been passionate about the profession, but those around me have also been the same. They demonstrated an enthusiasm about our profession that I just haven't seen in other professions.
Yeah. Okay, so if you had it to do all over again, would you have chosen the same specialty?
No question, I would have, and that would be orthopedics. I found out early on that my personality was one that celebrated reward fairly quickly. And in orthopedics, at least outpatient orthopedics, which is where I spent most of my time, you can typically see improvement, sometimes from visit to visit, and certainly from week to week. That fed my need to see improvement, and I think it fed my ability to be a better physical therapist.
It just got you excited and propelled you to keep going to see that
It
immediate
did.
response.
I didn't have to wait weeks to see some improvement. So that helped me a lot.
I bet so. Inspired you to keep going.
Yep.
Okay. Well, if you could travel back in time to when you were a student, what technology would you have taken back with you, or what advice would you have given your student self?
I think the use of laptops, computers, is the one that first comes to mind, because in 1974 and 5, when I was in PT school as a student, we wrote everything down, and nothing was really done on the computer. And through the years, both in the clinic and in PT education, we've moved over to laptops. Students, I marvel at watching them take notes in class, even today, on their laptops, while continuing to look at the professor. And when they are in lab and are, quote, treating or assessing their fellow lab partner, they take their notes, that they get the information that their patient is telling them, and they're on the computer, on their laptop over here. Whereas in the clinic and in school, when I was there, we didn't have that luxury. It's huge. I do also remember this that goes along with this question, and that is documentation. When I was in PT school and in early on in my career for a couple of decades, our documentation was with a pen, and that changed. And when it did change in the clinic, I fought it tooth and nail. I didn't want any part of it. And as soon as we began using the computer in the clinic, I wondered why I had been so resistant to it, because it's an excellent tool. Yeah, in thinking back, I think that as a student, for me, and even students that I teach now, they are trying so hard to master skills, techniques, the ability to interview a patient and to use their clinical reasoning skills to lead to a plan of care. And sometimes we forget that we're treating a real patient. I wish that when I was in school that I had thought about that a little more. These folks look up to us. They look up to us as professionals and people who are going to lead them in their personal lives. I think we leave that out, unfortunately. And sometimes it is even after we start clinical practice in the profession, when we finally come to realize that it's not all about techniques and where we place our hand and where we stand. It is about caring about our patient.
From what I've observed, our professors here at Campbell do a really good job of teaching that alongside the practical skills.
From the beginning, from the first year, they teach that for sure.
For sure.
Yep.
I've definitely seen it myself. So what's been your favorite career moment?
Clinically, there are a lot of them, but one comes to mind, and that was treating a patient who was a manual laborer who had neck pain, a lot of neck pain. And so when I evaluated the patient and decided what technique to use and what interventions to use, I decided to use what's called the McKinsey approach. And with his neck, it involved moving his neck back, extending his neck. And we did that. And in a very few minutes, his pain had been reduced 75% probably. And I wasn't satisfied with that in that very first visit. So we kept performing that technique where he did a part of it and I also did a part of it. I think this treatment was an exercise in patience, and I mean Patience. And I'm glad that I made myself demonstrate the patience with that patient to continue that same technique and not veer from that. And by the end of that one session, we had eliminated his pain, and he was so grateful.
Why would you encourage someone to choose PT as a profession?
For me, it was the variety of patient diagnoses that I knew we would see. At 8 o'clock, your patient may be a 70-year-old lady who has osteoporosis and has come to see you for a variety of reasons, pain being one of them, and posture and strength and so forth. And then at 9 o'clock, you're treating a patient who has had a stroke. And so your entire mode of thinking changes. At 10 o'clock, you're treating a child with cerebral palsy. And again, your scope changes. And then at 11 o'clock, here comes the patient with low back pain that needs you. And they have been referred to you by a physician who needed us to help that patient. That variety is one of the reasons that I got into it. And I think it's one of the reasons that I would recommend to anyone who might be interested or thinks they might be interested in PT, as opposed to perhaps other healthcare professions, is the variety.
Well, they say the variety is the spice of life, right?
Yep.
And that's what PT is going to bring you.
That's exactly right.
That's exactly. Okay. Why would you encourage someone to choose Campbell to get their DPT?
I think two reasons. One is the faculty. Clearly, this faculty is so talented. And I'm beginning my 11th year here as an adjunct faculty member. And I've seen a lot of faculty come and go. But this faculty is so talented, first of all. And secondly, they're so dedicated to student success. There's no end to what they do to try to assure students that they can succeed. And secondly, the program makes no apologies for including throughout the curriculum opportunities for students to demonstrate service to the local rural communities. I think this is intentional and allows the students to have an opportunity to consider service once they become physical therapists. Service in rural areas as opposed to perhaps urban areas.
Okay, so in your nearly 5 decades of practice, are there any just flagship moments that you can see that just shook the whole PT world?
Yeah, especially independent practice. Prior to the 80s, we relied on physicians to refer patients to us, and we could not legally treat a patient unless we had the physician's script in our hands. In the 80s, and especially in North Carolina in 1983, we accomplished what's called independent practice or practice without referral. That continues to the present time, and I would definitely say that that is a flagship moment in our profession, and especially in North Carolina. I think that one other contribution, I guess, to the profession was what's called joint mobilization. In 1974 and 5, when I was in school, we had what's called a physiotherapist from New Zealand come over, Stanley Paris. And Stanley came and spent about a week with us, teaching us how to do joint mobilization. We didn't know what it was. And as it turns out, it has stood the test of time and has continued to be one of the most important areas of treatment. I think the whole idea and practice of joint mobilization was a changing moment, and it was sort of a missing piece as far as I'm concerned. We had other techniques for improving range of motion and helping a patient's pain be reduced and so forth, but we never considered this. And I think that joint mobilization is a huge addition to our toolbox. With October being Physical Therapy Month, I couldn't be more proud to be a physical therapist and have the passion that I continue to have for our profession. One more thing I'll say, and that is I could not be more proud to be a part of this faculty.